I want to just conclude with discussing another part of the health care reform, and this is good for businesses, it's good for parents, it's good for children, and this is the insurance reform. I was the insurance commissioner in California for 8 years, 91 to 95 and 2003 to 2007. And during my tenure, I know the terrible things that the insurance companies were doing to their customers. First of all, a person would buy an health insurance policy, they'd pay into it year after year after year, then they would get sick. Probably a significant issue. Maybe they'd get diabetes or cancer, some other, maybe a heart illness, and it'd get expensive, and the insurance companies would go back. They would actually pay a bonus to their people to review those claims, go back to the original application that may have been made years before, and find an error. Perhaps it was something as simple as having acne when they were teenagers, or an asthma attack at the age of 3. They would then use that to cancel the policy, leaving the person high and dry, in deep financial trouble. The health care reform law signed by the President yesterday says no more rescissions. Those days are over. The health insurance industry in this year will be prohibited from rescinding policies and dumping people after they become sick. Now, for those that are already sick and don't have a health insurance policy, the legislation provides for people that are 50 to 65 who have a pre-existing condition, and this is the population that is literally unemployable because they're sick. They have some pre-existing illness, and no employer up there would want to pick them up because they know that if they were to hire that person, the cost of health care for all of their employees would go up. So those people are left out. But under the new law, there's a solution for them. It's a high-risk pool that starts immediately. It goes into place in the next 90 days. And those people, and there are millions that fall into this category, they'll be able to get insurance. They will not have to face bankruptcy. They will be able to be employable. This is an enormously important thing, and I've seen this in my days as insurance commissioner. We didn't have the ability to deal with this except in a very narrow way in California with what we call the high-risk medical insurance program. But now with the federal government assistance, people will be able to get insurance. The same thing for young children, infants. The day they're born, they come up with some serious illness. Let's say it's a heart issue. That child cannot be insured under the old program, but now that the President has used his left hand to sign the legislation, we now know that those children, from the day they are born until they are 26, will be able to get insurance, and their parents will be able to insure not only themselves, but also their child. The day I was sworn in, 2 days after I was sworn in, I stood here on the floor and I spoke about the health care reform that I voted on November the 6th. And I spoke about a dear friend of mine whose child was born with a kidney ailment. He and his wife struggled for years to find the money to pay for the insurance. Their insurance was canceled. They had it when the child was born, but their insurance was canceled by the insurance company because the kid had a very serious kidney problem. With the new law in place, the hardship that that family has gone through for now 20 years is over. The insurance policy that they had the day the child was born cannot be canceled. And so for that family, and millions of families like that, the insurance reform provides an immediate benefit. And for all of the men and women out there, the mothers and fathers that have a kid that is approaching the age of 23 and about to be thrown off the family's insurance policy, know this, that with the bill that was signed yesterday, and in 6 months, that child, young adult, will be able to stay on the family's health insurance policy until the age of 26. And I cannot even begin to count the number of calls that I've had and emails I've had saying, oh, thank God. I know as a parent that my child will continue to have health insurance at least until they're 26, and then at that time, 2014, the rest of the program kicks into place. Final point is this, and that is pre-existing conditions for all of us. At the end of this year, those pre-existing conditions will no longer be the case. Final point, and then I'm going to close long before my hour is over, and my final point is this. This legislation is fully paid for. Part of the money to pay for this is an obscene bonus that the insurance companies were granted 6 years ago. And that is known as the Medicare Advantage bonus. The average cost of providing Medicare insurance was calculated, and the insurance companies were given a 15% bonus to do what they should have been able to do without any additional money. We're going to end that bonus. We're going to take that money and plow it back in to the Medicare program. And the Medicare program, by law, no benefit reductions. That's what the law says. I hear a lot of other talk out there and a lot of scare tactics, but the fact is that the Medicare Advantage program will continue, but the bonus that was given to the insurance companies, an unnecessary, multi-billion-dollar bonus, is going to end, and the money will be put back into the basic Medicare program so that the financial solvency of the Medicare program will be extended 9 years. That's important to everybody that is approaching Medicare and is in Medicare today. So people are going to continue to want to live to get into Medicare. That's what's out ahead for the Medicare recipients, and I talked about the wellness program earlier. Final point is this. On the financial side of the health care reform, the deficit of the United States government in the years 2010 to 2020 will be reduced by $132 billion. That's in the first year. So that is a reduction in the national deficit. It comes about by reducing the amount of money that will have to be spent by the government on health care as a result of all of these reforms that are in the bill, some of which I've talked about tonight. In the next 10 years, 2020 until 2030, the deficit will be reduced by $1.3 trillion, an enormous amount of money. So whatever discussion you've heard out there in public and all of the mischaracterizations of this bill that have been going on for months, and indeed almost a year now, the facts are the deficit will be reduced, the program is fully funded, and it provides very, very necessary benefits immediately to small businesses with the tax credit to help pay for their insurance, for individuals ending the insurance discrimination, and for seniors, a major new effort to keep you healthy so that you can enjoy life more, and the cost of the Medicare programs will be reduced. With that, Mr. Speaker, I yield back and thank people for the opportunity to explain a very, very important part of the new America that we will have in the years ahead.